very grateful to be joined this evening by Dr. Alyssa Goodwin of Martins Point Healthcare, who is a pediatrician there, and Dr. Lawrence Losey, who is a pediatrician at Mid Coast Pediatrics, and by Melissa Focusato, who is the amazing, if the community does not recognize her, she is the amazing coordinator of our vaccine clinic at Mid Coast Hospital. And we are going to spend the next several minutes talking about the wonderful, we're very excited about COVID-19 authorization now to immunize younger adolescents, the 12 to 15-year-old sect.
What I've been telling parents for the last couple of weeks is there is a light at the end of the tunnel. I don't think it's a locomotive coming at us, but the light at the end of the tunnel is a return to normal life. And that's going to be because we will be able to beat COVID into submission. And the way of doing that is, well, two ways. Have everybody get sick and 1 or 2% of everybody die, or get a vaccine. And we have 3 fabulous vaccines. And since the beginning of the pandemic, 3.9 million children and adolescents have been infected with COVID-19, and it stands at about 270 of them have died from it. 14,000 children and teens have been hospitalized. One of the big changes we've seen in the COVID epidemic in the last 4 to 6 weeks, we've seen a tremendous increase in the number of kids that are getting COVID. Kids meaning people under 20. A year ago, as COVID was ramping up, we were seeing about 3% of the cases were under 18. Now it's 18.5 or higher percent. Just a tremendous increase. There have been mutations in the COVID virus, and the old folks like me have gotten our vaccine, and we're much less likely to get it. So the kids, the young adults, roughly half of the illness is in people under 30 now. So it's a really big thing. Getting the kids immunized is a key role in protecting the community. We see that with other diseases. If we can get the kids to not be passing it along to others, it will be much less of an issue. So that's why we're so gung-ho on getting the immunizations into the kids' arms. We have a motto. It's called grab them and stab them. Well, we really want to get kids immunized and stop the spread of this. This slide is an interesting one. I hadn't seen it until we were getting this ready. The yellow line is the number of, or the rate of cases per 100,000 people. Yellow is COVID, and most of us that are parents will remember just 11 years ago the H1N1. That's the blue. And we're having 5 times as many kids getting COVID as got the H1N1 that we were all at Twitter about. Now, fortunately with H1N1, we were lucky in Maine because it showed up late in May, and we had a chance to get a lot of people immunized. Sounds familiar, doesn't it? Immunization is a fabulous way to keep from getting sicknesses. Okay, let's go ahead to the next one. People are really concerned about the COVID vaccines because they're new. They're so fast. And it is unheard of for us to be able to have, from discovery of the disease to an approved vaccine in less than a year. That's just incredible. However, what they did, and the term I like to tell parents is, it was a massively parallel process. That's what the IT people say. They have lots of processors, lots of things going on, and they started manufacturing about the same time that they were starting the clinical trials. So that if the vaccine worked, they would have the vaccine already prepared and ready to go. But the big overlap was clinical trials went very rapidly, multiple sites. The FDA was involved in looking at what was going on from a very early point so that they could see if there were any problems, step in, make changes in the process, halt things. You know, there were some halts because of side effects that people had while they looked, was this related to COVID or did it just happen? You know, the number of people involved was exactly the same as what is usually done. However, it was spread out over 6 months instead of 6 to 10 years, which is usually what takes it. But it's the same level of study, the same level of research into what's going on as has happened for every other vaccine. The one thing that they didn't do is, for some reason, they could not do a 10-year follow-up in 6 months. So we don't have good data yet on how long the vaccine will last, but we're looking closely at it and following the first people immunized to see what we can find out. So people worry that this was something new, and yes, these are the first widespread vaccines that have been used with messenger RNA technology. However, there was 15 to 20 years of research before COVID showed up. There were other vaccines that went through human trials for Zika virus and for Ebola virus using messenger RNA. And so it's not like it was a sudden bolt of lightning that they did this. They used existing networks of institutions to begin the COVID-19 vaccine trials. They did a lot of data interchange so that people could know what was going on in other places. And they got their manufacturing up and going at high levels before the vaccine was approved. And it was a gamble. It was a gamble with your dollars and my dollars. However, Pfizer also used a lot of their dollars just to get the plants set up to make the vaccine, start making it before it was approved, and that would have been totally worthless if the vaccines hadn't worked out. So there's been a lot of research. This is very global, multiple countries involved in all of this. And because of the messenger RNA technology, these vaccines are faster to produce in large amounts than the old ones. You know, influenza vaccine, most of them are still made by inoculating chicken eggs with influenza virus. And I remember one year we were late in getting flu vaccine because it was so hot in Pennsylvania that the chickens didn't lay their eggs. So these are some things that we've moved past. The FDA, the Centers for Disease Control, have put a top priority. And, you know, it was cute calling it Operation Warp Speed because it really was working things as fast as possible, but it was not shortcutting. It was working together, planning things through to get this out to save lives. Am I supposed to do this? Yeah.
So just following what Dr. Losey so eloquently laid out, we have 3 really good vaccines available in the United States. And because of the current approval for use in kids down to age 12, we'll largely focus on the Pfizer vaccine. However, we are getting some early reports that Moderna is submitting data for adolescents also that is looking really promising. And that's largely probably because they use really similar messenger RNA technology, as Dr. Losey just described. There is a third vaccine from J&J, or the Janssen vaccine, and that works a little differently and currently is only authorized for patients 18 and older, so a pretty small group of our adolescent patients. But for those patients, it can be a really great option because it is a single dose. So again, focusing on the Pfizer and the Moderna, and more specifically the Pfizer because of its availability. As Dr. Losey just described, there was pretty robust trial data. Again, the way I described it to my patients when I talk about this is when you put a lot of money and a lot of brains together, you can come up with solutions, which is, I think, what led us to this day. You can see the data there that the efficacy in both the Pfizer and Moderna vaccines is really pretty phenomenal. I think we now have a pretty good handle on what vaccine reactions are typical with the first and then the subsequent second dose. And so we kind of caution and give patient advice about what to expect with that. One of the big differences is the dosing interval. So Pfizer is at 21 days, which actually is great for our adolescents as we're trying to get them vaccinated before summer, which is great. And then the Moderna is a 28-day dose interval. And again, as I previously mentioned, the Pfizer is approved for use down to age 12 as of last week, and the Moderna currently at age 18, although again, that data is probably pretty close to being reviewed, and so hopefully we'll see the Moderna vaccine come online for adolescents as well, which would really open things up. One of the big differences, you are probably aware, because it's been one of those cold storage 2020 vocab words, is the cold storage and the cold chain, which the Pfizer does require. And so that has been what has limited its distribution a little bit, because a lot of hospitals are really the only places that have that sort of storage. And so again, it is a little bit more of a fragile vaccine, just being refrigerated for 5 days with the Pfizer versus the Moderna. So again, some small differences, but that certainly do impact its use in the community. So like I said, super exciting as a pediatrician and as a parent. Last week, the Pfizer vaccine did receive emergency authorization for 12 and older. As I mentioned, it is 2 doses, 21 days apart. Currently, it's widely available, and there's a lot of appointments and availability. So if you are so moved to get your child vaccinated after this talk, you can do it tomorrow at the Mid Coast COVID-19 Vaccine Clinic. I will just mention that our Martins Point practice has also worked hard to secure some Pfizer vaccination, and so it's not as readily available, but it is available if Portland is easier for you to get to. And then the Moderna, like I said, is approved for 18 and older, and they are currently seeking approval for the younger ages. So again, as a pediatrician, I say to my patients that COVID in schools and COVID in kids and COVID vaccination is probably the thing I know more about than anything I've ever known about in my entire life, which I'm super happy to have that information. I long for the day where it's no longer relevant, but some of the early data as it was being released around the Pfizer vaccine was truly astronomically effective and just really, really reassuring. So in the Pfizer trial, there were about 1,100 participants who received the vaccine, and throughout that, no patients received a COVID-19 vaccination, received a COVID vaccine diagnosis, so none came down with COVID. And the control group, similar number, they did not receive the vaccine, and 18 were diagnosed with COVID-19. In addition, the antibodies that were measured in the adolescents who received the vaccine were found to be even higher than the adult counterparts, really again reflecting what seems to be a really effective vaccine for our adolescent patients. And so also as a pediatrician, I spend a lot of time talking to my families about vaccines long before COVID-19, and the COVID-19 vaccine came along. And as Dr. Losey had mentioned, the science behind this vaccine, which feels new to many of us lay people, lay providers, those who are not on the front line of emerging infectious diseases, felt new. And as a pediatrician, not something I was super familiar with, but in understanding these vaccines, again, really realizing just how clean they are is sort of the word that I think we've all been using. There are very few ingredients in the Pfizer and the Moderna mRNA vaccines. So there's some messenger RNA that codes for the COVID-19 spike protein, that little red spike we've all come to know and dislike. There are some stabilizing agents that just allow the medication to maintain its effectiveness. There's some lipids, basically fat, holding it together, and then some salts and some sugar, and that's it. And then on the red box, you can see the list that it does not contain. And again, as a pediatrician, many of these ingredients are things that, I've spent a lot of time talking to my patients about. And so as this vaccine is new, it's really nice to be able to say it's a really clean vaccine. The science, again, behind it appears really robust, and it works.
So just to take off where Dr. Goodwin left off, people, because it is new technology, have concerns because it is, they hear mRNA and they worry that it is going to interact with our cell's nucleus and somehow change our DNA. That is indeed not the case. What it does is it teaches our cells to make a protein, in very minuscule amounts, and then that mRNA actually degrades very quickly within our cells. So it does not enter our nucleus in any way. It does not change our cellular composition or our DNA in any way. It teaches our immune system and exposes it to very safely, actually, to this spike protein, so our immune system can make the memory antibodies and induce a memory response to this foreign protein. And the mRNA then is really quickly broken down and goes away. So it is a very slick, safe technology. And then I think at the beginning, when people first started to uptake on both of these vaccines, there was a lot of press around allergic reactions and immediate allergic reactions, because first the vaccine was deployed to healthcare workers in a large in large quantities. And so there has been concern, and I certainly have received questions from patients around this. And it was very interesting, some of the things I've heard back about this. But people with a history of immediate allergic reactions to other vaccines should talk to their physicians, and I've had those conversations. If you do carry an EpiPen, bring it with you. You may be asked to be observed longer than the 15 minutes that most people have been observed. Some people are being observed for 30 minutes, but that is not a contraindication. So if you have an allergic reaction to a bee sting or peanuts or something like that, you can still get this vaccine. If you happen to be one of those very, very, very few people now that have had severe allergic reactions to any ingredient in one of the mRNA vaccines, then you should not get the second dose. That is the reaction. That is the recommendation. But those severe allergic reactions seem to have decreased, and there's some theories going out there that the medical community as a whole may be more exposed to one particular component of that vaccine, the polyethylene glycol in particular, than the general population, and that may explain some of that. To be determined, but again, very rare side effect. And it is not, anybody that carries an EpiPen can still very much safely get this vaccine. So side effects from the vaccine are not uncommon and are being tracked. Serious side effects are very uncommon and occur early. But the most common side effects include fatigue, pain at the injection site. Some people are seeing some local rashes at the site of the injection, fever, chills, achiness, and some nausea, vomiting, and headache. Some people are definitely reporting more profound, noticing these side effects after the second vaccine, and it's fine to use measures to keep yourself comfortable if you're experiencing these side effects: fluids, Tylenol, rest after the vaccine. Symptoms that we do not think are from the vaccine include shortness of breath, loss of taste or smell, or cough. That is not from the vaccine. So particularly if you happen to get your first vaccine and you've been around the general population, or there could be a rare chance that you're exposed to somebody with COVID, it takes 2 weeks until after you've had the second vaccine to be considered fully protected. So there is the opportunity for you still potentially to acquire infection after that time. And because the data suggests that really it's optimal to have 2 doses of the vaccine in that window period between the first and the second vaccine, there is potentially the opportunity, unfortunately, to still get sick with COVID-19. So if you develop classic symptoms of now what we come to understand of being COVID-19, you still should seek care and evaluation for acquiring COVID. And there have been documented cases in that scenario where people have acquired COVID-19. The big questions that we don't know the answers to, of course, because this is all new to all of us and things change. That is the one constant surprise of COVID, or should not be a surprise, is that things are always changing with this virus, is that we are not sure how long the vaccine will provide continued protection. This is ongoing study. And I will say one thing we know about the vaccine world is that this is one of the most surveyed constantly studied measures in the healthcare community. There is a lot of robust data being collected. There's a system for reporting side effects and severe side effects. We are always looking at how people respond and react to vaccinations. So we are learning more and more as we go. And as Dr. Goodwin pointed out in our discussion before we came on, even within the last week, we've given over 500,000 doses of COVID vaccine to our adolescent population. So we expect to learn rapidly from how our adolescents do, and we've given millions of doses at this point to adults. We are, one big question that continues to evolve, but we have some suspicion, is whether or not the vaccine, we understand, prevents infection, symptomatic infection, and severe disease from COVID-19, but it's unclear whether it can decrease the transmission of the disease. There is more and more evidence that is mounting, and there's some data from some of the early Moderna work that it does indeed prevent the transmission. So there's more data to be collected. Again, we just started a little over a year ago, so it's remarkable how far we have come in a year and how much we've learned, but we're also humbled by how much we have to learn, to continue to learn from our experiences. So this is just to sort of start us off. We have a lot of resources. There's a lot of information out there. And again, there's a lot to sort through. Our high recommendation is that this is a safe, very effective vaccine for our adolescents to receive. And we are here to answer any questions that any members of the community have. We highly recommend it. It will keep our youth safe and our community safe. So we are happy as clinicians in the community to address any questions that anyone would like to post in the chat. And again, there's a multitude of resources available from Mid Coast Hospital, from the Children's Hospital of Philadelphia. They have a wonderful vaccine education center, and they have a space where if you happen to think of something later, that actually they have a place where you can post questions, and there are clinicians there that will often respond to them and post some of the more commonly asked questions available. There are resources from the Maine CDC and the American Academy of Pediatrics, and of course the US CDC. So thank you, Dr. Goodwin and Dr. Losey, for being here. And I'm just going to check into the chat just to see if people have questions, and give people a moment, because I know I don't type too fast. I use 2 fingers. And, oh, I see one over here. Let me just get over here. Here. Would you, oh, here's a question. Would you give this to your own children?
I can answer that.
I'll give that to you, Dr. Goodwin.
I can answer that because I think in this group have with children in this new age group. I have a just turned 11-year-old and a 14-year-old. Yes, I not only would I have, we expected that this approval would happen. We'd been expecting it for a couple of weeks because the data was just so compelling. It just felt like as this process rolls out, like this was going to happen. And so last Monday when this approval came out, my daughter, who is a freshman in Brunswick, and I had signed her up for a vaccine later in the week. And then when we became aware that she could actually get it on Tuesday, we went straight from her tennis match and got her vaccine. And it was awesome. As I was thinking about what other things I think are important to think about as we process this medical question, one of the things that I really think about as a general pediatrician are, of course, in a pandemic, you're worried about COVID and acute infection and MIS-C and cardiac complications and all of these inflammatory issues. But I'd say the pandemic that has been affecting me as a primary care pediatrician more up until pretty recently, as this has become more of a pediatric illness, is the mental health pandemic that we are navigating. And so thinking about, risks versus benefits, and as Dr. Hagler, you just have really laid out the really minuscule, predictable risk, self-limited side effects versus the very real risk of continued isolation and disruption. What I've said to my patients and my daughter is, this is how you get your life back. And we've experienced that. And I think we've benefited from that as adults. And, Larry, as you said, you just sort of feel the anxiety and the stress of being isolated and being worried about getting COVID and sharing it and getting quarantined from something at school or whatever, and start to feel like you're getting your life back. So I think that's a huge benefit that can't really be overlooked.
And I'm going to ask you another question that has come up in the chat is, both of you are school physicians. What potentially are the benefits as kids think about, what will the fall look like for middle schools and high schools having kids vaccinated?
I'm happy to start with that, Larry. The benefits is sort of what I just was alluding to, that when you are fully vaccinated, meaning both doses as well as the 2 weeks post-vaccine, that you don't have to quarantine if you have an exposure. And so this actually came up at the Brunswick High School recently, where there was a case that did involve a large number of close contacts. And many of those, just based on their age, were not the full 2 weeks post-vaccination, but had it been a week later, they would have. And we would have seen a significant decrease in the number of kids who were affected in quarantine. So again, back to that mental health piece, you're not constantly worried about being tagged for a quarantine and having disruptions in your life as we're starting to get back into sports and activities. So the benefits are huge across the board. So.
Here, you're absolutely right, Alyssa. Sports, I've seen cases where a team suddenly had to be isolated because someone on the opposing team was found to have COVID the next day. And so, boom, they're out. If everybody on the team is vaccinated 2 weeks after the second dose, you don't have to do that. I really see this as our ability to return as soon as possible to pretty close to our normal pre-vaccine life. Little things like chorus, band, having dinner with your friends, having a sleepover, all of those things. And we cannot emphasize enough how horrible this has been on the kids' mental health. Yeah. We are seeing so many kids with anxiety, depression, stress symptoms because of the isolation from COVID. And the educators estimate kids are losing about 3 months of this year's schooling just because of not being able to have school regularly. And so the benefits are just astoundingly good. And, we talked about, for example, the risk of a severe reaction to COVID vaccine. It's about the same as the others, 1 in a million. Other vaccines also have very uncommon severe reactions. So, one thing I would say is don't everybody in the house get their second dose at the same time, because you can be feeling miserable. I know that I felt under the weather for 3 or 4 days. My wife felt under the weather for 2 or 3 days. My daughter felt under the weather for 3 days. My 18-year-old granddaughter felt that way. The 15-year-old hasn't gotten in yet, but she'll get it. She'll feel icky for a few days, but nothing compared to all of the stress that we're having to go through from people getting COVID and being exposed to COVID.
I think also too, again, echoing everything you said, it adds this other layer of protection when you're around members of your family too, like with grandparents or grandparents that may be on medications that reduce the effectiveness of their immune system, or are in different treatments for chemo. Even if they've gotten the shot, there's some suggestion that their shot may not be as effective. So if you have an immunized teenager that wants to be around a grandparent that's on certain medications or has certain health conditions, it's providing an extra level of protection for them. So I think of the same thing. We do layers of protection for everything, and it just adds additional. It's one more layer of protection to get your life back.
Well, on a very personal level, my wife and I have a grandson that turns 1 year old next month. He lives in Southern California. We've never seen him except on FaceTime. And the 3 of our kids that live out of state and their 4 kids are all coming to Maine to spend the last week in August. And, the vaccine makes it possible for us to do that. I was out in California seeing my son, and I flew back on March 8th of last year, just as everything was falling apart. And that caused a little bit of stress for all of us.
So one thing to just people that want to get the vaccine, we have walk-in appointments. We want to make this as low holds barrier for people as they can. So the Mid Coast Vaccination Clinic has walk-in hours from 9 o'clock in the morning till noon, and then from 3 o'clock to 7 at night. And then, Melissa, I think the state of Maine is actually also providing transportation to walk-in clinics. Is that correct? You can call the state of Maine for rides, as far as I'm aware of.
Correct. And if you're in a local school and you see this before, we're also going to be at the Brunswick schools, the Freeport schools, and SAD 75. So if you keep an eye on your school's websites, you can also have your adolescent get their shot right there at school.
Right. We want to make this as convenient for people as possible. And I think I'm going to I don't see any more questions, and it's a beautiful Maine evening in the spring, so I don't want to take time. Larry. Larry, yeah.
I heard this afternoon on the Dr. Shaw show, and that was the state of Maine will organize a vaccine clinic at your house of worship, your job, your school. If there are 10 people that need a shot, they'll send a team out to do that. I don't know if they'll be able to do Pfizer vaccine for the teens, but we're really going after people, trying to find where people are, grab them and stab them.
Oh, great. That's so we really want to get the vaccine to people in our state. And Melissa, will you just give directions? So the vaccine clinic for Mid Coast is going to move to Medical Center Drive on June 1st.
Yes. June 1st, correct.
Okay. And that all that information will be available. Hold on. Wait for it, everyone.
www.midcoasthealth.com/vaccine.
So we want to get our community and our state vaccinated.